So on a daily basis, I might not give a proper average because we receive those who come in as emergencies, we receive those who come in as referrals in late hours, we receive those who come in the night, and maybe post-treatment effects. So admissions are about 8 to 10 per week.
These children come from which place? You talked about some of the places they come from. So are you Ugandans or from other countries?
These children come from Uganda and other nearby countries. Okay, but majority are Ugandans from the different parts of Uganda. I cannot be specific to this only or not. This is a national referral, so they come from any part of the country. Yes, we have satellite centers like in Membara, where we have most of the Western children now captured in Membara, but sometimes for some other treatment modalities like radiotherapy, surgeries, because as we treat our children, we are having different treatment modalities, which include chemotherapy, surgery, radiotherapy, basically for the children, that's it. So for those who can afford to.
Hi Cynthia, hi Dr. Yvonne. So we have patients who have come to support us in the run, and they have come to our ward. The doctor is saying you're most welcome. She's a little bit soft. Yes, we employed to load. Yes, so this is a team that has come to support the Childhood Cancer Color Run 2025. So they are doing a ward tour.
Thank you.
So she's called Dr. Our phones are not allowed to take pictures like especially the faces. We can do the ward pictures, but we don't take their faces unless they agree to take our photos, okay? Yes. Kindly. You have relaxed a little? Oh, you're still relaxing. Sit down. Please come.
That is being spearheaded here by Uganda Child Cancer Foundation. So there are reasons why children with cancer in Uganda and other LMICs are not surviving. And one of them I mentioned, they are not diagnosed. Somebody doesn't even think that they have cancer. In some parts of the country and Africa, there's actually no word for cancer in children. So nobody actually thinks it is cancer at all. So they think about other things, including or it's a misdiagnosis where somebody will actually see a child who has cancer but thinks they have TB, brucella, typhoid, sickle cell disease, and all manner of other things. So those children actually have a misdiagnosis that they presented to the health system. And then of course delayed diagnosis. Because if you're going to be treated for your cancer, you really have to present to a cancer treatment center at the UCI. But as the children are referred along the health system,
Mr. Andrew Court. Our survivors. And Andrea. I'm seeing very short signatures. Okay, survivors. Priscilla, can we have another marker? Just can we? Our partners, Timothy, Maria John, President Galaxy.
As Dr. Joyce mentioned earlier, the social aspect of cancer fight or cancer management is very, very critical. What the foundation does is exactly that. And we as a foundation come together to address what we call the social, psychosocial costs Dr. Joyce talked extensively about the indirect costs of cancer, and this is real. And unfortunately, it is not emphasized very often. When people talk about cancer, or somebody's ill and somebody comes to the institute, what comes in the mind is treatment, and that is treatment, and that should be